Hi, I'm Dr. Castanet in Decatur, Georgia. Today I'm going to talk to you about applying heat to pain-related problems in the neck or the back. I often encounter patients that do that. Sometimes I don't find out because I don't ask them always explicitly about that, and sometimes they won't volunteer it if I don't ask them specifically about it. But oftentimes I will ask the question when I think their pain presentation is more than I would expect given their complaint, or there's something about the clinical presentation that seems discordant in the way of the severity of the symptoms and their complaints. But it is a problem that I encounter with some number of patients, and let me tell you why it's contraindicated, in spite of the fact that some therapists and doctors will even encourage you to use heat as a modality for pain. Here's the reason it's contraindicated, at least relatively. When you have pain, it typically, you can infer that there's inflammation in the area. Inflammation, there might be some exceptions to that, but generally that's true if you have either a recent injury or even a chronic injury that is perpetuated and persists in spite of treatment. In fact, that's another scenario where I have to remind myself to ask specifically about whether or not they're using a heat modality. And if they are, it's almost good news, because then it often explains presentations that otherwise are a little hard to understand, and it can explain also why people sometimes don't respond to treatments or haven't responded to treatments. But here's the story with inflammation and why heat is contraindicated. Inflammation is a chemical process. It's cascade of chemical reactions, hundreds of them, that combine to make this process of inflammation. And inflammation is made of 4 components, sometimes a 5th, but the mnemonic we use to remember what inflammation means is RSHP, redness, swelling, heat, and pain. Sometimes loss of function, because an inflamed tissue may be difficult or impossible to use. So when you have pain, you can infer that inflammation is causal in your pain. That's almost always true, and it's a safe bet. When you add heat to any chemical reaction, you will drive that chemical reaction, because remember, or maybe you don't remember from science, that temperature, the definition of temperature is the average kinetic energy, meaning the kinetic energy of molecules. And because molecules combining and driving inflammation, because that inflammatory process is dependent on molecules combining, if you want to drive the process more, move the molecules more, they will combine more, and you will drive the process and make the symptoms worse. Unfortunately, sometimes heat is immediately relieving or can act as what we call a counter-irritant, meaning it provides another stimulus for you to feel, and it overrides your pain perception. So sometimes you feel an immediate relief from the pain for the duration for which you're applying it, such as if you sleep on it at night for an hour or something like that. But subsequent to that, several hours later, because you have driven the inflammatory process more, you can get an increase in your pain. And then, unfortunately, because it is misleading, you think that the appropriate response is to apply heat again. And this can drive the process and turn what would otherwise be a sometimes even a self-limited problem, but a problem that is remediable, into one that just is perpetuated by your application of heat at home. So a better choice is ice. What ice will do is, applied locally, will slow down the chemical reactions, and thereby slowing down the interactions of the chemicals that are driving the inflammatory process and bring down the pain. Also, ice can act as a counter-irritant like heat does oftentimes, and because you change the temperature in the region, you feel that. Plus, it can also slow nerve conduction because nerve conduction is dependent also on chemical processes that drive impulses down axons of nerves or up axons for you to sense the pain. So for many reasons, your best bet is to use ice. You can do it for 20 or 30 minutes at a time. There are several stages of sensory perception that you will pass through, but you want to get to the point where you feel numb in the area. You don't want to apply it for too long, although frankly, I've broken that rule myself for ankle sprains, but in any case, probably half hour at most is a good idea, then take it off and let the circulation reestablish itself in the region and wait maybe a couple of hours, and then you can do it again for another half an hour. I would probably limit it to 3 or 4 times in a day, just to make sure you don't do any tissue damage. When you do it, you want to use only, say, a t-shirt or a thin shirt or thin fiber. You don't want to use a thick towel because then you're never going to really appreciate the benefits of ice. You really want to numb the area with very cold sensation. So a thin t-shirt or blouse or something like that is sufficient. Don't put it directly on skin because there's a potential for skin damage. That's also why you want to limit the duration for which you use it and even the frequency during the day. But that is a much better option. Do not use heat for pain just because you can really drive it and make it worse. I do have lots of patients that do that. Most of the time I figure out to ask that question, and we reveal it, and then we correct them in that behavior, and oftentimes that in conjunction with what I'm doing will get them over this problem and correct the problem. So that's the story on heat. I explain it in detail because I want you to know mechanistically what's happening, so that when you get recommendations from other healthcare providers about using heat or even alternating heat and ice, you understand that the basis for that isn't really steeped in good science, and there's a rationale for ice. There seldom is for heat. Occasionally you can use heat if you have stiffness, but not if there's any likelihood of an inflammatory component causing your pain or as the cause of your pain. So that's the story on heat application for injuries. If I can help you, let me know. I'm in Decatur, Georgia. My number is 404-558-4015. And the website is backstrong.net. If you go to my website, there are a host of other videos on a lot of other topics, including surgery, pain management, sciatica, herniated discs, etc. And I think you can learn a great deal there. You can also find a link there to my YouTube channel where I explain a lot of things. And again, you can watch videos there as well. Thanks very much. Thanks. Bye-bye.